Before electronic data capture, clinical trials ran on paper. Case report forms printed, completed by hand, shipped to sponsors, and manually entered into databases. It was slow, expensive, and riddled with transcription errors. EDC changed everything. Electronic data capture systems let clinical sites enter trial data directly into a validated database in real time. The CDM builds and owns that system for every study. The major platforms, Medidata Rave, Viva Vault EDC, Oracle Clinical One, and REDCap, all operate on the same core architecture. Data is entered into structured electronic CRFs. Validation rules check it instantly on submission. When a site enters a value that fails a check, a query fires automatically. The CDM's job is to configure every form, every field, every validation rule, and then test it all thoroughly in user acceptance testing before the first site goes live. When a drug reaches the FDA, the clinical trial data in the submission was captured through an EDC system built by a CDM. That's not a small thing. Understanding EDC is the single most important technical skill for any aspiring clinical data manager. It is the tool the role runs on.